An inflated sense of self-importance characterizes narcissism. It's a personality disorder characterized by a need for constant admiration and a lack of empathy for other people. People with narcissistic personality disorder sometimes have difficulty maintaining healthy relationships and may be prone to episodes of rage or aggression. While people can't completely understand the cause of narcissistic personality disorder, they think it is from a combination of genetic and environmental factors. Experts can treat symptoms of narcissistic personality disorder with therapy and medication. What is narcissism? Narcissism is a personality disorder. An inflated sense of self-importance also characterizes a deep need for admiration and a lack of empathy for others. People with narcissistic personality disorder often think they are better than others and have difficulty accepting criticism. They may be very charming at first, but their true colors eventually shine through. Narcissism can lead to problems in relationships and work settings. And it's not just the narcissists who suffer, many people around them can become drained by their behavior. Narcissism, symptoms and signs. While narcissism can be healthy in small doses, it can become harmful when excessive. Narcissism can manifest in several ways, including grandiose behavior, need for approval, and an excessive focus on the self. Signs of narcissism. While some people may just think of themselves as high-powered, others who think they suffer from NPD may not consider themselves abnormal. That is a big difference. A common sign of someone with a narcissistic personality disorder believes that they are superior to others and deserve special treatment. Selfish people are highly confident and may believe that the rules don't apply. They are usually manipulative. Whether they admit it or not, a narcissist has a big ego. Their most significant need is to be admired, and they will do anything to achieve this. Narcissists will make sure that they have a lot of friends and always want to be around people. However, they're just as likely to show their true colors to people if they feel like they are being left out. People with narcissistic tendencies may even exploit others to get what they want. The need for praise or admiration is one of the most common signs of a narcissist. Narcissists tend to brag or exaggerate accomplishments for recognition and often put on a fake persona to get others to admire them. People who lack empathy are generally unwilling to put themselves in another person's shoes or care about their needs and wants. People who can't are more likely to exhibit narcissistic behavior, which can be seen in many forms, such as manipulation and lack of accountability. Symptoms of narcissism. The narcissism signs and symptoms of narcissistic personality disorder vary in severity. Individuals with NPD or occasional narcissistic behavior may have a great belief in their abilities and talents. A tendency to be preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. And a persistent inability to learn from experience. Most people are not motivated by success, yet they seek it out anyway. You can be one of those people. You are a perfectionist driven by an inner compulsion to achieve excellence in your work or life. People will associate with people who they believe are better than them. This is a result of self-image. It is not a bad thing. It is a normal part of human behavior. People tend to associate with others of like mind. If they find themselves in a room full of more brilliant people than them, they tend to feel less competent themselves. They might feel that it is their responsibility to help the less intelligent group feel better about themselves. People are generally motivated to please the people they work with and expect them to do the same. You can look at it as a benefit, but it can also be a drawback. Be careful what you ask for because you may get it. They don't know what other people need or want. Behave arrogantly or haughtily, coming across as arrogant, boastful, and pretentious. Types of narcissism. Narcissistic behavior can be broken down into two distinct categories based on childhood experience. Some people are born with a high level of narcissistic traits and personality features. They are typically the ones with splendid personalities. The second type is vulnerable narcissism, rooted in feeling worthless or helpless and having been neglected, mistreated, or abused. As they grow, these expectations will continue to follow. They usually brag and have a movement to be elitist. Grandiosity is a standard feature for a person with grandiose narcissism, aggression, dominance, and who prefers doing things alone. They are very self-confident and aren't sensitive. This habit is usually the outcome of childhood neglect or unhealthy parenting. People with narcissistic behavior and true narcissists have a hard time understanding that other people are just as important as they are. They often believe that others are only interested in them for their reasons, making it hard to understand that people will not always want to take care of them. Sexual narcissism. We can describe narcissism as an egocentric pattern of sexual behavior where one's sense of entitlement is so great that one doesn't realize that their behavior is causing problems for others. Narcissists are usually sexually promiscuous because they don't realize the emotional and physical toll that such a lifestyle takes on them. The research shows that this behavioral pattern is more common in men than in women. In fact, It can occur in both sexes who are compensated for feelings of sexual inadequacy by becoming excessively proud or obsessed with their masculinity or femininity. Some people refer to the condition as a form of sexual addiction. Sexual addiction, however, is a controversial term as some mental health professionals believe it is a form of sexual compulsivity rather than an addiction. Parental narcissism. Narcissistic parents may regard their children as extensions of themselves and influence them to act in ways that support their emotional and self-esteem needs. This can harm the children. They are vulnerable to this type of parenting, which may cause them to struggle in adulthood with their intimate relationships. For a parent to effectively parent, they must understand the nature of the child they are attempting to parent. To do so, the parent needs to see the child in its entirety. In the extreme, this parenting style results in estranged relationships with children coupled with feelings of resentment and, in some cases, self-destructive tendencies. Workplace narcissism. Narcissistic professionals seek validation from others who can confirm that their ideas and decisions are correct. As with most forms of insecurity, professionals can't feel confident in their abilities until others agree with them. And if someone else agrees, it's easier to say what a real professional should look like. It's the narcissist in all of us. We dread appearing stupid or incompetent. Executives have often been confronted with these narcissistic triggers, the general workforce. Narcissistic personalities can create problems in the workforce. While many people believe that narcissistic people can't be helped, there are ways to deal with those individuals in the workplace and even to help them see the error of their ways. Narcissists don't realize that they're being selfish jerks. Consequently, they find themselves in groups where they get mistreated by others and looked down upon. Celebrity narcissism. The same factors may trigger celebrity narcissism as standard forms of narcissism, but its intense focus on the subject distinguishes it. It is most clearly seen in stars like Madonna or Britney Spears, who are known for the extremes of their self-presentation and their frequent public displays of immodesty. Fans, representatives, and media at all levels all play into the belief that greatness is more important than anyone else. This triggers a narcissistic problem that can be latent, or one which may have been a tendency, but becomes a full-blown personality disorder when there's too much attention. Collective narcissism. Collective narcissism is a type of narcissism in which an individual has a high opinion of their group. While classic narcissists are self-centered, this doesn't mean that groups aren't also capable of narcissism. Collective narcissism is when one has an extremely high opinion of a group without considering others. This narcissism is usually not limited to groups but rather to a particular social unit. Normalization of narcissistic behaviors. Critics contend that the American public has become increasingly narcissistic since World War II. While people compete to gain attention in social situations, online culture has grown with social media and digital media. People compete mightily for fame on the internet and television in this new era. The growth in American narcissism is a well-established social psychology phenomenon identified worldwide. The analyses documented a greater emphasis on personal pronouns, reflecting a growing interest in self-focus and the focus on antisocial behavior. Simultaneously, there was also a simultaneous decrease in positive pronouns, indicating a corresponding drop in personal affirmations and opinions on other people. Linguistic analysis shows that individualism and personalism increased significantly among Norwegian-speaking individuals in the Public Broadcasting Council's recording of the largest newspaper between 1984 and 2005. Abstract terms, conversely, decreased between the years tracked. There has been a 4,500% increase in the use of self-focused and individualistic terms over the last 30 years. References to narcissism and self-esteem in American print media have experienced vast inflation since the late 1980s. A study in the Journal of Communication in the 1980s showed that there had been almost zero mentions of the concept of narcissism in American newspapers before that time. In fact, between 1987 and 2007, the use of narcissism increased by more than 5,000%. In 2007, references to narcissism in American newspapers were at their highest point to date. Healthy levels of narcissism. Narcissistic behavior is a way of coping with a lack of self-esteem. An individual might become narcissistic to gain status and admiration from other people. Or it may be used as a way to cope with feelings of inadequacy, especially feelings of loneliness or inferiority. It has been advised that healthy narcissism is related to good mental health. High self-esteem works as a mediator between narcissism and psychological health. As a result, high narcissists are relatively free of worry and gloom because of their elevated self-esteem. The difference between narcissism and pathological narcissism. Pathological narcissism, narcissistic personality disorder, is an uncommon condition that can severely impact a person's day-to-day life. Narcissistic traits such as a lack of empathy and an inflated sense of self can be highly disruptive and result in serious relationships. Pathological narcissism is the extreme form of narcissistic personality disorder, NPD. Pathological narcissists are not necessarily violent, but they can be. They can also be incredibly charming and charismatic, sometimes leading others to believe they have great charm. Narcissism in relationships. A narcissist's wish to be admired and praised often causes them to be charismatic and charming, two qualities that can enhance the romance. But their inherent deficit of empathy may prevent them from understanding a partner's inner world and establishing a fulfilling long-term relationship. There is very little chance for adults with narcissistic personality disorder to achieve success while developing a sturdy relationship with one another. This individual may insist on rigid rules for relationships and isolate them from family and friends, among other disturbing behaviors. When to see a doctor and treatment. People with narcissistic personality disorder don't care if they're doing something right or wrong, they just want to get their way. However, they are doubtful to seek help, so if they require treatment, it is often for depression, substance abuse, or another mental health issue. But perceived insults to self-esteem may make it difficult to accept and follow through with treatment. If you're experiencing a depressive episode, you may find yourself feeling as if nothing seems to be going right in your life. You may be having trouble focusing and concentrating, feel tired all the time, and be sad. These symptoms are consistent with a depressive episode. In addition, people with narcissistic personalities tend to have an inflated sense of self-esteem. If you think this may describe your own experience, consider seeing a therapist. The process of treating a disease is a little more than just taking a pill. You have to address the underlying cause, and the body is a complex, interconnected system. Your doctor is an expert in the area and can tell you how to manage your situation with the right mix of lifestyle changes, medication, and treatment. Dealing with narcissism. Narcissists don't seek help because it doesn't fit the self-image they have of themselves. To treat narcissism is to challenge the distorted image of the self and teach the person to accept the authentic self rather than try to be like someone else. They might need the assistance of a loving friend to seek help from a professional. Suppose you recognize that you're in a relationship with a narcissist. In that case, you can alter your relationship with dynamic and challenge your partner to change how they view you and your relationship. It is possible to change how you look and feel about yourself by recognizing and changing your thoughts, beliefs, and self-image. To make the change, first, you must understand the narcissistic personality disorder, NPD, and its effects on your relationships and yourself. You can stop evaluating yourself against others, lowering your need for praise and recognition. In conclusion, narcissism is a complex condition that can be difficult to diagnose and even harder to treat. To help someone with narcissism issues, you must be able to recognize the signs and symptoms. If you or somebody close to you has problems with narcissism, help is available, and you should seek treatment.